The following program contains images of an actual surgical procedure that may be graphic and disturbing. Parents are advised that these images may not be suitable for young children.
2017 was the year of the rear, but what are the new hot plastic surgery trends right now? Board-certified plastic surgeon Dr. Ashkan Ghavami joins Dr. Ordon to give us all the inside scoop. So let's talk top trend, docs.
Well, 2 words, fat transfer. We now found that we can take fat from one area, don't throw it away, don't put it in the medical waste, put it to good use. I have a patient I did for the show, we did a combination of liposuction of the abdomen, the hips, the flanks. She was not a candidate for silicone breast implants, so we put fat in her breast. She didn't have a ton of fat. I think we put in 400 cc's per side. Got a wonderful result. I think both of us will agree when we're doing facial rejuvenation now, facelifts, most cases we're moving the shape. It's shaping and adding volume where you need it, because we know part of aging is losing volume.
I always tell my patients, the plastic surgery and beauty is never about size. You can be a size 14 woman and look damn good in it, you know? Or you can be a size 6 and not look good because you're kind of square and you want proportions, you want more hips. In the face too, it's all about facial contours. When we look at beauty, we look at convexity, we look at highlights and shadows, the way that the light hits the body or the face. But fat transfer is no joke. We're seeing problems with it when people aren't injecting it properly, especially in the buttock. There are disasters that can happen because if you inject it in the wrong place, it can go into veins and things. So you have to go to an expert. You have to go to a board-certified plastic surgeon. No plastic surgery is any joke. It's not going to a med spa. You have to do it expertly and do it well. But the technology is amazing, and we're still learning about fat. It has so many benefits.
If we can switch a little bit, you know, not all plastic surgeons are biggies on doing rhinoplasty, nasal surgery, and the two of us here really have pretty much dedicated our practices. It makes up a large part of what we do. I know you love doing it. The recent royal wedding with the new Duchess, right, Meghan Markle, has stimulated, rekindled an interest in rhinoplasty, right? Before it was Angelina Jolie, everybody came in with that picture wanting that nose. Now they're
Well, Meghan Markle, the good thing about her is, what I love about her is a lot of plastic surgery. I mean, rhinoplasty started in 500 BC in India. So the roots of rhinoplasty are ethnic, they're non-Caucasian. So Meghan Markle is absolutely stunning, and she has best of both worlds. And if you look at her nose, it's not that, there's a little hump, but who cares? The tip's a little wide, but who cares? She has beautiful features. Her tip has that sculpted shape, and it really works for her. It's beautiful. It has a good shape. It goes with her. And it's what I call, racially congruent. It doesn't look awkward on her, and it has the proportions that match her face. It's not too small, not too big. And with rhinoplasty, it's in the center of the beauty triangle. So if it is a little bit off, it can throw off everything else.
But you do, I'm assuming, have to tell patients who come in and say, hey, I want Angelina Jolie's nose or Meghan Markle's nose. That may not be the right nose for them.
Exactly. These days, people bring in Facetune Photoshop photos of themselves on their Instagram.
Oh, yeah, they do.
They're experts now. Like, I have 17-year-old girls that come in for rhinoplasty, and I'm like, how did you do that? It looks gorgeous on their Instagram feed.